for joining every week. This week we have a topic related to my most recent promotion, which is about complimentary consult day. So I got a lot of questions about how to get the consult, and I always get this question: how do I get a consult with you, Dr. Vidal, and why? Why should you get a consult with your plastic surgeon? And I'll go over different options of consultation, which is we have different options because everybody's a little different on the approach they want to go through their plastic surgery journey. So I think that's also important that you have options. Everybody goes through this journey in a different time of their lives, in a different mental being. So it's important to have options that are tailored to you. So that's why we have different options, and I'll go over them, and then we'll jump in for your questions, okay? So basically, the easiest way is to go to our website. I know I have a lot of patients that are like, I just want to call in and just book a date with you and just go to the office and talk to you. The reason why it's better to do it this way first, of course you can come into the office, but the reason why I like this approach first is because it's a filter, okay? The reason why it's a filter is because not everybody's a good candidate for surgery. You may need to lose some weight. You may not be just a candidate because of your medical conditions. You may just be asking for a procedure that it's not really tailored to you or what you need, right? So the first step, so we can kind of go over the steps, is go to our website or my link tree in every social media account. It can be mine, it can be yours, it can be TikTok, Instagram, Facebook. There's always a link tree that has all the contacts there, and there's a link to our website. And if not, just Google Pure Plastic Surgery Miami, and the first one you'll see is our website, which is pureplasticsurgery.com. When you open the page, there's a link that says virtual consult form or get a consult. You click there and it'll ask you for a couple of questions. The questions are like very basic: your name, your age, date of birth, and what procedure you're interested in. And that's one of the things that a lot of patients are like, I don't know. Put anything, right? If you are interested, I don't know, I want to get rid of my belly. Put lipo. I mean, it doesn't really matter. It's not that you're booking for that procedure. I'm not asking you to be the plastic surgeon and decide, right? And a lot of patients are like, that's why I'm going to you, because I want you to tell me what I need. And yeah, I get it, but it's just so we have the initial form and we can tailor it to the area of concern, right? I may see the picture, and then once you fill in all this in, and the other part is the pictures. A lot of patients are like, I don't really want to send any pictures. I feel self-conscious. But the pictures tell me a lot. Tell me a lot about what procedure is best for you. And since I'm not seeing you in person at this stage, it can help me guide you in what procedure is the best for you, depending on your anatomy and the area of concern, right? So once you fill that in, at least 3 pictures. One front view. What are the tricks for a good picture? Good lighting, okay? Lighting. So if you're taking it in front of, let's say, a window, the window is going to reflect to the light to the phone. So you have to be towards the light. So then the shadows don't blur the areas that I want to see, okay? So if it's completely dark, just put the flash. Or if you have windows with light, you try to be towards the light, so then the shadows are not causing blurs in the picture, okay? And at least 3 views of the area of concern. If it's the breast, then a front view. Try the camera. You can do it yourself. You don't need someone. You can put a timer, but try to put the camera at the level of the breast, if it's the breast, at the level of the belly, if it's the belly. When you're doing selfies or when you're doing angles, it's very hard to evaluate what I want to see: the degree of ptosis or droopiness, the volume of the breast, where the nipple lies in relationship to the fold, all those things, okay? So at the level of the area you want to address, same with the face. If you're taking a picture from the bottom, I can't really see the angle of your jaw, the neck. I want it at the level of your face, okay? So one front, one 45 degree, and then one 90 degree of the area you want to address, okay? Once I have those pictures and the basic medical conditions, medications, surgeries that you had, then I can prepare a guide for you, okay? Most of the time, this is pretty accurate. Have I done patients that we've changed the operative plan on the day of pre-op? I get this question a lot. Extremely rarely, but it has happened, okay? It's not impossible that then you come to pre-op day and after I examine you, you're like, you know what? I think it's better if we did X, Y, or Z, okay? If you're still in this area, like, you know what? I send the pictures, then the coordinator in 3 to 5 business day will give you a call and she'll go over what I proposed for you, right? And you're like, but I still want to meet the surgeon. I don't want to fly to Miami, or I don't want to wait until surgery, pre-op day, which is the day before the surgery, to talk to you and to go over my concerns. I want to be prepared. I want to talk to this about them. We have 2 options, right? We have a virtual consultation, which is talking to me through a camera, or an in-person consultation. And your coordinator is the one that's going to help you book this, okay? So it's like, I don't want to talk to this person, I just want to go talk to you. Well, she's going to be your contact person, so then you can come either virtually or in person to meet me, okay? So still, that person, your coordinator, is going to be your right hand through all the preparation for surgery until surgery date, okay? Your contact for all the questions, all the things. How long do I have to stay? When do I have to do this? When I have to do that? That's your right hand, okay? That coordinator is going to be with you and guide you throughout the whole process until surgery day, okay? So again, if you like receive the surgical recommendation and you're like, you know what, I'm still like, what about this and that? I want to talk to you. There's 2 options. What are the pros and cons of each one, right? Like everything in life, there's a benefit and a little bit of a disbenefit of an option, right? The virtual consultation, the benefit is if you're from out of town, you don't need to travel, you don't need to come to Miami to meet me. We can meet virtually at any date, right? The other one is time constraints. I have patients that are even here in Miami, but are like, oh my God, I have to work, get the kids from school, I have a baseball practice that I have to take, then I have many things, and I can just take 30 minutes of my day and have a virtual consultation with you rather than driving to your office, taking an hour here, talking to me, and then driving back, right? So if that's the case, there's always this option, even if you're from Miami, okay? There's always the chance of virtual consultation. What's the benefit of coming in person? Well, a great benefit, right? You meet the office. You meet not only me, but you meet our staff. You see what we're all about. You see, I have a lot of patients that are like, I always see the videos, and in the videos and in the stories, your team seems to be very integrated and you seem like a family, and you get the chance to see that in person, even before the surgery. So in-person consultation gives you that vibe, that thing that you can't really feel virtually, right? It also gives me the chance to examine you. There is always a benefit to examine you in person, of course. And that's why I don't see my patients the day of surgery. I want to see you before, and that's my limit, it's the day before, because I know that patients travel and asking you to come weeks in advance is not realistic. But if you're from Miami, there's, I think, the benefit of an in-person consultation, or I have patients that are not from Miami but have a planned trip to Miami and you're planning for surgery next year, then come meet me, take just an hour of your day, come meet us all here at Pure. And there's always the benefit of me examining you, not only the area of concern, but sometimes we go over different areas that you're thinking about. I can check the skin quality that I can't assess really from a picture. I can assess the ratio of the visceral fat, which is the fat that is inside your belly, versus the fat that is subcutaneous that we can take care of with liposuction. I can touch it, I can feel it, and I can tell you in more detail than with a picture. I can also assess muscle separation, that it's very, very hard to assess just from a picture. I can ask you to sit, to stand up, to fold, animate. Those things are harder through a picture. And the other one is breast. Breast assessment is harder from a picture because in person, I can palpate the breast, I can see the density of your breast. I can also take your measurements, and we can talk a little bit more implant sizes. You can see the implants here in the office and try to get an idea of what is the goal, what will be your goal implant size, even weeks or months before your surgery, okay? So this, I think it's always a great option. I understand that it's not the reality for everybody, and I don't think that if you don't do the in-person consultation, then it's a disbenefit for you. You will meet me the day before the surgery and we'll go over all this. And like I mentioned, there have been times that we change the procedure, and that's okay, right? You have to keep that open mind to when you talk to me and after I examine you, there may be a very slight possibility. Again, this is rarely happens, but there's slight possibility that after I examine you in person, then and talking to you and you seeing things here in person, we may change the surgical plan, okay? So all these things are important on the consultation. And why I'm talking about a consultation, because I did a complimentary consultation day in April, and it was so popular. I love talking to patients. I love sitting and talking to you guys, and I had so much fun that day, meeting a lot of new patients, going over their surgical plans, and it was not only good for me, it was good for you guys, and I got very good feedback, and I tailor my practice to the feedback that you guys give. So I decided to open another day, and because two things. One is that a lot of patients said that on the weekdays is hard. I understand. You guys work, kids, all of this. So, and the other one is the next few months are busy. So I always have surgeries. So to get a date that I had nothing and blocked to do consults was almost impossible. So I'm opening a Saturday, okay? Saturday, May 31st. We're gonna be here all day. Willie's like super excited about this.
Yes, I am. I'll be doing content.
Willie is dying to be here Saturday, May 31st with me all day.
At 8 a.m.
At 8 in the morning. I'll bring you coffee, Willie. But really, it's for new patients only, okay? I want this time for patients that are still deciding for surgery, okay? If you are already booked, then you're more than welcome to talk to your coordinator and do these two options, but not Saturday, May 31st. Saturday, May 31st is for new patients only. If you had surgery with me, for example, and you're thinking about another procedure that it's not booked, then yeah, I mean, you also can give us a call regarding that. But this Saturday, May 31st is for new patients that want to visit the office, meet me, and there are virtual options too if you're not from Miami and you want to take a moment to meet me. There are virtual options as well. Okay, it is we opened this. When was it? Monday? No.
Yes.
Last Friday. Was it or yesterday?
No, yesterday.
Yesterday. I don't even know.
What day is today?
Tuesday.
Tuesday tips. Yes, yesterday.
So we opened this yesterday and it's already booking, you know, we're seeing movements. So if you are interested, get a time right away because it's filling up very fast, okay? Easiest way, go to my Instagram. There's a post about it with a link. In my stories all the time, you'll see posts about the Saturday, May 31st consult day, and there's a link there so you can book the time that is best for you, okay? I'll jump for some questions now if you guys have them.
Okay, but we have comments, questions,
Okay.
manitos waving, and we have an announcement after your live.
Okay.
The winners.
Yes, that's awesome.
And a special surprise at Dr. Rigger's account. So tell them this.
Okay. So yes, if you follow our aesthetic account, then you've seen that we did a giveaway for Mother's Day, and we have the winners for that, and we're going to be announcing that soon. If you don't follow our aesthetic account, then you need to start following our aesthetic account. Is Aesthetics by Simple?
Correct.
Aesthetics by Simple. Okay, so check that out, and if you participated on the giveaway, then we're going to be telling the winners after the live. And apparently, Dr. Wiggerib has a big announcement as well.
Yes.
Okay.
And yay!
Yay!
This is perfect beauty. She said, "Yay, Dr. Vidal, I'm booked for July. I'm so excited."
Awesome.
Happy face with a party hat and confetti.
I love it. That's awesome. July is coming right around the corner. So enjoy the summer, the early summer, so you can be ready for surgery day in July. Love it.
Oh, can you talk more about Alloclay?
Yes, Alloclay. So Alloclay is this new product in the market that I am super excited about because it is something that we've been kind of hoping some company started offering, which is fat on a syringe, right? We know of all the benefits of fat, not only for augmentation, but also for stem cells and rejuvenation. So we're doing fat grafting, we do it every day here for BBLs, for volume and shaping of the torso. I do it for breast. I think it's a great alternative to implants. And I do it as well with combination of facelift or face procedures. We can do fat transfer to the face. Those are the 3 most common areas that I do fat transfer of. But in the reconstructive world, fat transfer is used for other things because we know the great benefits of fat. But the only limit is we need to do liposuction. We need to harvest from you. So if you're very skinny, we didn't have fat. And we need to harvest it and inject it the same day. So you have to prepare for everything. And we were like, why don't a company just puts fat in a syringe? Where there were a lot of problems with that, but this company has solved all those problems and our problems. And now we have fat available in a syringe. Where does it come from? I heard or I read in TikTok a lot of people freaking out about cadaveric fat. I'm like, oh my God, they're using cadaveric fat and injecting it to people. Let me tell you guys, cadaveric donor tissue, it's been used in medicine for decades, okay? It's now for fat, but we've been using cadaveric tissue for decades, for mesh, for cartilage, for different things, for skin, for skin and burns. I used cadaveric skin to cover burns thousands of times, okay? So this is not something new. This is not something you need to fear. And the good thing about specifically alloplate is they took the fat, which is fat from human donors, and they decellularized. So the cells are still intact, but all the components of the cell and all the receptors that make that cell immunogenic, which means that your body is going to react to it, they've taken them away, okay? So the cell structure is intact with all the extracellular space, which is the collagen or the framework to make it stick and support. So we have a perfect combination of what we needed, which is the cell and the structure without all the rejection material that will cause your body to reject it. And we have it in a syringe that you can inject it to all the areas that I mentioned. Well, the face not yet, but possibly soon. So the body, okay? Focusing on the body. Alloplate is for the body because it comes in larger volumes, 12.5 cc's or a box with 25 cc's. You can inject it in the hips, in the buttock, or in the breast, okay? Great product if you're in, and it can be done in the office under local anesthesia. You don't have to go to surgery. Downtime is barely like anything, very minimal. Some soaring, some discomfort, but you can travel in and out the same day because you're not getting general anesthesia for that. I think it's a great option. So a lot of patients that, for example, had a BBL and have some flat spots, this is a great option. You don't need another round of lipo BBL. Patients that are very skinny, athletic patients that are very toned and don't have fat, but they want to get rid of the hip dips, great alternative. Very skinny patients that have sometimes implants, but they see like the edges of the implant or the rippling. This is a great option to camouflage that without the need of lipo, without the need of surgery and general anesthesia. So if you're interested, give us a call. Super excited about this product. Yes.
At Dr. Wigert and at Dr. Earl's account, I just post in these days some procedures, one on the breast and one for the
If you want
butt.
to see before and afters, we have before and afters in our accounts. Check them out. All the surgeons and January nurse practitioner are doing the procedures. So we have before and afters on each account. So check it out.
Español.
Okay.
Hola. Quería saber cuál es el procedimiento que se hace para la piel flácida de muslos.
Muy buena pregunta. Los muslos es un área que es difícil de tratar en el gimnasio. Cuando tenemos piel suelta en esa área, especialmente en el área interna del muslo, por más de que hagamos ejercicio, por más de que tonifiquemos el músculo, que tonificar el músculo siempre es bueno y siempre lo recomiendo, pero esa piel laxa que está en el centro, cerca de la ingle, es muy difícil de desaparecer. Dos cositas que te puedo recomendar. Una, si el laxity la piel no está tan severa, la liposucción con body type, que es radiofrecuencia en esa área, ayuda mucho a que mejore la apariencia. Si ya es más severa, o sea que ya tienes pliegues en esa área, entonces un thigh lift o remoción de eso y levantarlo va a ser la mejor opción. Dependiendo de la cantidad de piel, es el tipo de cicatriz. La que trato de hacer y ofrecerle a todos mis pacientes es una incisión que queda en el pliegue de la ropa interior, o sea, en la ingle, y básicamente remover esa piel y subir el thigh. Hay personas que, especialmente la pérdida masiva de peso, que tienen piel que se extiende hasta la rodilla, pues entonces esas pacientes a lo mejor necesitan esa incisión más una que va a lo largo del borde interno del muslo hasta la rodilla. Pero no todo el mundo necesita ese tipo de cirugía, todo depende de la cantidad de exceso de piel que tengas. Si quieres que te evalúe, esta es la mejor manera.
Dr. B, see you on June 17.
Awesome, that's coming up very soon. You probably already got your pre-op over the phone.
Well, for being honest, she said in June. I don't know why I said 17. Just in June. See you in June, Dr. Vidal.
Really just creating a date for you. So that's awesome. You probably already had your pre over the phone. So if you have any questions, let us know. Super excited to meet you here.
Okay, this is about the alloclate too, and she asked, Manette, do you still have to not see it for a month like a BBL?
Not that much. So depends on the area. I'm gonna ask you not to apply direct pressure to the area for at least 1 to 2 weeks. So for the hip dips, you can lay on your back, it doesn't matter. If it's like on the buttock, I may ask you to like lay on the sides or not directly over the fat grafted area. So remember, this is not for a full BBL, so you're not gonna get the alloclate in all the areas of the buttock. So specifically in the area where the fat is injected, I'm gonna ask you to like off the pressure. You can still sit, you can still lay, but you're probably gonna have to modify a little bit.
Can someone prone to keloids develop keloids in the face after facelift?
Very good question, and this is a common question that I get very, very rarely. So the reality is the skin is very different in the face. It's very thin. So the amount of keloids depends, it is correlated directly with the type of skin. So you probably see more keloids in the ears because of the cartilage relationship. We see more keloids in the back. We see more keloids in the areas where the skin is thicker, like the elbows and the knees, okay? When the skin is thinner, Willie's pointing at his elbows. So when the skin is thinner, like for example, the eyelids, I've never seen a keloid in the eyelids. This is extremely rare. The area where in a facelift you may keloid or may become hypertrophic most commonly is behind the ear, okay? Extremely rarely the one that goes in the ear itself, but the one that's in the scalp, that it's behind the ear, sometimes develop keloid. So if you're very, very prone to keloid, I will have to see the areas where you're mentioning, because sometimes people say that they have keloids, and when I examine them, it's like, that's really not a keloid, that's a hypertrophic scar and has an explanation. So for example, a lot of patients are like, I fell when I was a kid, I had an injury here, and now I have a keloid. And I'm like, that probably healed on its own. You didn't get stitches, and when you have a wound that heals traumatically by secondary intention or it heals on its own, it's more prone to develop hypertrophic scars. So that's not an indication that you will develop a keloid in other surgical areas that we're closing and stitching, and it's not traumatic. So depends. But if you see a keloid, extremely rare, it's behind the ear, which is it's easy to treat, hide, and manage. Okay?
Tan tan.
Thank you so much, you guys. I hope this helps kind of understand our consultation process. Like I mentioned in the beginning of the live, different options for different type of patients. Not everybody wants to come in person. Not everybody wants to do virtually and book the same day of the virtual consultation, but we have all the options tailored to each specific need, okay? And remember, Saturday, May 31st, we'll be here all day. Book now because it's getting full, okay? I'll see you guys. Well, I don't know if I'm gonna be able to do live next week. I'll let you know. But if not, I'll see you the following week, definitely.
Thank you. Yay.